Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everybody, and welcome to episode number 26 of the Better Health Guy blogcast series. Today's guest is Dr. Raj Patel, and the topic of the show is Beyond Lyme Disease. Dr. Raj Patel has extensive experience with various natural therapies, including nutritional medicine, homeopathy, herbs, and mind-body medicine. Integrating these diverse therapies with allopathic medicine has enabled Dr. Patel to offer a highly refined approach to healthcare that produces lasting results. Since 1993, Dr. Patel has specialized in helping patients struggling with chronic fatigue syndrome, Candidiasis, food sensitivities, thyroid and other hormonal imbalances, chronic infections, and heavy metals. Over the years, Dr. Patel has specialized in treating patients with Autism Spectrum Disorders, as well as Lyme disease and other vector-borne diseases. He began working with autistic children in 1999 and to date has helped over 500 children on their road to recovery. Another area that Dr. Patel specializes in is treating Lyme disease. It is well documented that patients with chronic Lyme disease also suffer with candidiasis, food sensitivities, accumulation of heavy metals, and hormonal imbalances. With his background in treating these conditions, Dr. Patel has been able to create a comprehensive program for treating those struggling with chronic Lyme disease. He's found incredible success in treating individuals with chronic Lyme by combining antimicrobial treatments with heavy metal detoxification, food allergy desensitization, and hormonal support. Dr. Patel is an active member of the International Lyme and Associated Diseases Society and has completed advanced training in pediatric Lyme disease. Dr. Patel first began to look into Dr. Richie Shoemaker's incredible work on chronic inflammatory response syndrome resulting from exposure to water-damaged buildings in 2010. He found that many of his Lyme patients who had experienced only partial improvement turned out to be simultaneously struggling with toxic exposure to water-damaged buildings. When they began responding dramatically to simply getting out of their home and taking cholestyramine, Dr. Patel's interest was piqued to learn more about Dr. Shoemaker's treatment approach to this illness. Dr. Patel today integrates the findings from Dr. Shoemaker as well as other doctors working with mold illness to see patients making impressive recoveries from this debilitating illness. Dr. Patel has been a personal mentor for many years and someone that I have learned a tremendous amount from. And now, my interview with Dr. Raj Patel. So I am excited to have you on the show today to talk about Lyme disease and mold illness. You've certainly been a mentor of mine for several years, and I'm looking forward to talking to you today and sharing your perspective with our listeners. So thanks for being here, Dr. Patel.
Thank you for having me, Scott.
So can you share a little bit about your own personal journey through Lyme disease and mold illness, and is that what drew you to treating these conditions today?
Well, yeah, it's an interesting story. I think I got my original tick bite back when I was in school in New Jersey, probably in the late 1980s. Don't really remember having a tick bite, but I remember a few years later when I was in my family practice residency, working long hours, I started developing a very tiny patch of psoriasis on the back of my scalp. And I think that was my first sign that there was something happening. Later on, I moved out to the West Coast and started my private practice. And I think the stress of running a private practice for the first time, my system started to get run down. And I noticed that there was a gradual progressive fatigue that started to set in. And as that fatigue got worse, and I started looking at a number of different, tools, diagnoses, blood tests, you name it. I really couldn't figure out what was going on until about 2004, 2005, when I finally learned about the existence of chronic Lyme disease and realized that that's basically what I had. So over the next 5 to 6 years, into about 2010, I tried all kinds of approaches, and you've got to realize back then we really didn't have these wonderful master blends, with different herbal formulations that we have now. So I was experimenting with individual antibiotics and individual herbs, even tried ozone, rife machines, a number of different tools. Eventually, by 2010, 2011, the Lyme was pretty much gone. And I was feeling, reasonably well. And then I started to get sick again all of a sudden, and realized that it was mold. The church that I had been going to pretty regularly, had periodic leaks in the winter during the rainy season. And even though I'd been going there pretty regularly for 10 years and had never had a problem, all of a sudden, I remember just this one specific day, I went home after spending a few hours there, just absolutely exhausted. And it was like all my Lyme symptoms had come back. So that was around the time that I started exploring the work of Dr. Shoemaker. And over the next couple of years, I was able to not only get certified, but I also was able to use myself as the first first patient. And I went through the whole program. And with the VIP, I was able to raise my MSH levels from less than 8 up to about 70. It was a remarkable journey.
Wow.
It took a couple of years because there was a lot of hidden mold that I didn't realize I was being exposed to. So as my MSH levels climbed, my energy started coming back, and I've really started feeling really well.
Yeah, that's fantastic.
So, it's been an interesting, walk.
And it is interesting. You mentioned a lot of the tools that we now have, like some of the herbal blends and things. I laugh sometimes. I look back on my journey, and when it first started, we didn't even have Google yet. So it's like, trying to find information and tools. I think there's a lot of things that have emerged over the last several years that really make treating these conditions give us at least more options. One of the things that I've felt really powerful about your work is your depth of knowledge with both Lyme disease, but then also mold, as you mentioned. And so can you tell us a little bit about how frequently you find environmental exposures to mold impacting the health of someone that you're working with that really identified as more Lyme disease? And then is it common for both of these to present in your patients, and does one set the stage for the other?
Well, that's a very good question. We know both mold illness and Lyme disease are associated with immune compromise. We know that they both trigger the same inflammatory pathways. And as a result, they both have very similar symptoms. And what's also very interesting in that when I say that they're both associated with immune compromise, what I mean to say is that you could be exposed to Lyme bacteria and live with it for years if your immune system is strong. And then something comes along and it will stress your immune system, and then all of a sudden the Lyme bacteria starts multiplying and taking over the body, and you start developing progressive symptoms. Mold illness is also very similar because even if you're genetically mold susceptible, you could live in a moldy place and be exposed for a long time. And then when something else hits your immune system, you all of a sudden kind of tip over and start developing this inflammatory immune response and start getting sick. And I think the other thing also to keep in mind is that if you have one, you're definitely going to be at risk for developing the second one. And there are sometimes cases like in my situation where I came down with the Lyme disease first, and having used a lot of antibiotics, I think it really compromised my immune system and set me up for becoming sick from mold.
So it sounds like in someone with chronic Lyme, it's not at all uncommon for mold to also be part of the picture that maybe hasn't been explored and needs to be explored.
Yeah, I would say if you've got Lyme disease and you're treating it and you're not responding, you've got to stop and you've got to step back and take a look. Because, in my experience, I find that treating Lyme is really not that hard if that's all that you've got. But majority, 99% of our patients have all kinds of other things going on. They may have blocks in their detox pathways. They may be reacting to electromagnetic fields. They may have dental cavitations, root canals. They may have mold exposure. And any one or combination of these things is going to put a wrench in your Lyme treatment. So if you're not responding to your Lyme treatment, you got to step back. And out of all these different blocks, I've got to say mold is the number one. It's the most common thing that I find.
Yeah, I would absolutely agree. And having gone through Lyme and mold myself, I would say at this point that mold was certainly a bigger factor in my own journey than Lyme ever was. And I think that's true of other people. Dave Asprey from the Bulletproof Coffee, Bulletproof Exec has certainly talked about that as well. So I'm wondering, when you're working with someone with Lyme and mold, is there an order that you follow from a treatment perspective? Which approach leads to less resistance in terms of making their treatment journey less difficult? Do you generally start with Lyme or do you start with mold?
My first approach when I see a patient that has a diagnosis of Lyme or comes in with a positive blood test or I'm suspecting that they have Lyme, once a diagnosis is made, my first job is to really look for what's going to block the treatment. So before I even start treating them, I'm going to look for viruses and mold exposure, if they're actually developing mold illness and inflammatory response to the mold exposure, if they have parasites, if they have major genetic impairments in their detox pathways. So it's really about optimizing the person's body, supporting their immune system. If they have a big issue with the EMFs, address that. And if you do your homework first and lay that foundation, the Lyme treatment goes along much, much easier.
Perfect. That's very good. So do you use the HLA-DR testing in your practice, and do you find that it generally correlates to what the patient's primary issue is? And then from a treatment perspective, do you find that certain genetic combinations are more difficult to treat?
I do the HLA testing routinely on my patients. The main reason is that it kind of gives me an idea what to expect. It's not so much that if someone is mold susceptible that they're going to have mold illness. That's not always the case. But if someone, let's say, has a positive Lyme test, but they're not genetically Lyme susceptible or multi-susceptible, let's say they're only mold susceptible, what that would tell me is to look for mold very carefully, number one. And once I've got them in a mold-free environment, their Lyme treatment will actually go along really, really easy. I find that as a general pattern, people that are not Lyme susceptible or not multi-susceptible will typically recover from Lyme if there's no blocks, typically within 6 to 8 months, pretty quickly. Whereas individuals that are multi-susceptible or Lyme susceptible, you've got your typical, 2-year horizon.
Yeah.
And the flip side is that someone may have mold illness even though they're not mold susceptible. It's rare, but it can happen.
So it sounds like the treatment in someone who is multi-susceptible may need to consider additional factors, but it sounds like those people still, that their treatment outcome can still be quite positive.
Oh, absolutely. I think that there's a lot of fear on the internet, especially with certain HLA types like 4353 multi-susceptible, the dreaded type.
You're looking at one of them.
And to me, it's just something to take into consideration. Sometimes these patients need a little extra support in terms of supporting their exit pathways. I may go a little bit more slowly when I treat them, but they respond just fine.
Absolutely. I agree. And that's been my observation as well, is that the detoxification piece of it is really more of a focus, or needs to be more of a focus, in those people that are multi-susceptible HLA types. That was my personal experience as well. What do elevated C4a and TGF beta 1, or transforming growth factor beta 1, what do these tell you? And while they're non-specific markers of inflammation, I understand that you have observed a pattern with significantly elevated C4a levels in some patients. So can you tell us about that?
Yeah. So C4 is a cytokine split product. It's typically associated, elevations in C4 are associated with viral reactivation, chronic Lyme disease, mold illness, and even autoimmune illness. And actually, even more recently, with mast cell activation disorder, we've seen elevations in C4A.
Wow.
There was a study done by Dr. Shoemaker where he found that patients that had purely Lyme disease, C4A, would typically go up to about 10,000, normal being less than 2,800. Viruses and mold will typically cause much higher elevations. Although, again, if you have mild elevations, you cannot rule out viruses and mold. But when you do see a very high reading, you've got to entertain that there's something else going on besides Lyme.
Very good.
The markers as a whole are elevated, with both mold and Lyme, and we do use a sequential testing. Primarily, the challenge is that when you have mold illness, you don't have a simple blood test to prove that that's what you've got. So you've got a complicated picture. You've got to look at symptoms. You've got to look at the response of the inflammatory markers and see how they change with something that you give them that might bind to the mold toxins and remove them from the body. So whether you're using bentonite or cholestyramine or Welchol, if mold is what's primarily driving the inflammatory markers, you're going to see a sharp drop after being on those binders for a month or so. And that essentially will give you your diagnosis. And then along with it, you should expect to see a significant symptom improvement most of the time in these individuals also. The last piece of it is where you have the person go back into the moldy environment without cholestyramine, and typically within a few days, you'll see a spike in all of these inflammatory markers. And that gives you, it seals in the diagnosis even more strongly, but it also gives you proof that they're reacting to their home and that there's the presence of water damage.
So that is, I think, what we talk about, the C4A sequester test. And after someone's been on cholestyramine for a period of time, looking at their C4A level, if they then go back into the environment and their C4A level significantly rises, that then sounds like that's a clue to you that that environment is probably not safe for their recovery. Is that correct?
Yeah, absolutely. Because the challenge is when you have a building hygienist or mold expert come in and they do a thorough inspection, and granted, really good, well-qualified mold hygienists are hard to find. But even if you get one of the best ones, there's no guarantee if you've got hidden mold exposure that they're going to always find it right away. So we always rely on both the inspection and testing of the building, as well as the patient's inflammatory response, if there is any, to the building. And if nothing is found and there's no inflammatory response, then you can be reasonably certain that the building is safe.
So let's talk about some other ways then to test. So I'm familiar with the ERMI or the Hertz Me 2. Are those tools that you use in your practice, and do you find them to be reasonably good indicators of a mold problem in someone's home or workplace?
I think out of all the different ways of testing a building, I think the ERMI is really a wonderful tool. It's cheap. It's a good screening, and it's private. It's something that an individual can do on their own. The big key is just making sure that you do it correctly. If you don't, you're going to get a false normal reading.
And do you prefer, for the ERMI or Hertz Me 2, do you prefer the vacuum canister sampling method, or do you prefer the Swiffer cloth method, or does that really make a difference?
I've personally always recommended a Swiffer cloth. Typically, the procedure involves collecting 8 to 10 samples, 1 or 2 from each room, so that you're sampling the whole house. If the house is extremely large or you have 2 floors, I'll typically have my patients do 2 separate ERMIs, one upstairs, one downstairs. And you want to make sure that the dust that you're collecting has been there for at least 4 to 6 weeks. It's been accumulating. You want to collect samples typically from top of different surfaces, whether it's a bookshelf, top of a refrigerator, top of a door frame, top of a ceiling fan. These are typical areas that don't get disturbed. And if you get a decent sample, you should get a fairly reliable ERMI.
So in cases where mold is identified in someone's living environment, how often is that something that can be remediated versus the person ultimately needing to move to a new environment?
This is typically a long conversation that I have with my patients once we've made the diagnosis of mold illness, number one. And number two, we have strong evidence that there is moisture damage in the house. And that could come from ERMI, or it could come from the inflammatory markers spiking when they go back into their home. There's a couple of different things to take into consideration in helping patients decide which way to go. If they've been the principal owner of the house, the original primary owner, they've lived there for maybe 10, 15, 20 years, and they know exactly where the leaks are, then there's a much higher likelihood that we're going to be able to successfully have the house remediated. A lot of the times, however, patients have only lived in the house for maybe a few years, and there's a long history that we just don't know about. If a house has probably had multiple leaks, throughout, the chances of being able to successfully remediate it to a level that would be safe for this individual, starts to drop very fast. The other issue to also take into consideration is that you really never know how much it's going to cost, especially if there's multiple leaks that you don't know about from the past. What might look like a simple job may end up turning out to be a much more extensive, process of remediating. So sometimes it's wiser to just, move out. And in other cases, if someone's really planning on staying in their house long-term for the next 10, 20, 30 years, then it would make sense to make that investment.
So given that 50 to 70% of buildings in this country have potential levels of mold that would be difficult for someone with a HLA-DR predisposition to water damage building illness, when someone's exploring then a new environment, do you generally recommend that they do an ERMI or Hurts Me Too or something like that before they sign papers and make a purchase? What kind of testing should they do before doing that?
As a general rule, I find that if a house is fairly new, less than 5 years old, but it has also gone through 1 or 2 rainy seasons, and there have not been any leaks, because some of the new construction is really not well made. Builders can sometimes take shortcuts, and then you find out after the fact if you're buying a brand new home. So if someone's gone through, if a building's gone through 1 or 2 rainy seasons and hasn't had any leaks and is fairly new, you're probably going to be safe. Other option would be to buy a home that's been extensively remodeled. That could also be fairly safe. But I think if you're going to make the investment in buying a home, you have to have it properly inspected and tested.
So
probably on multiple levels.
So you sneak in with your Swiffer cloth and just do a little swipe.
You can do a little tag team approach, distract the agent and take some samples. You can also take air samples. If you have someone that's doing ART testing, they can test to see whether your body is getting stressed from the air samples. And if you have the luxury of a little bit of time, you could go in there and spend a few hours in the building and get your inflammatory markers tested afterwards and see if they've gone up.
Interesting. Yeah, that's great. Just for those listening to clarify, so when Dr. Patel's talking about ART testing and air samples, we're not talking about air sample testing like most inspectors would do for mold. That's more of an energetic type evaluation using autonomic response testing or other types of energetic testing that can be another clue in some cases, not necessarily an endorsement of air sample testing like others may think of. Are there particular air filters or dehumidifiers? Are there other things that people can do in their environment while they're kind of working through the mold issue to try to minimize the exposures as much as possible and maximize their recovery?
Air filters can help dramatically. I tend to recommend them for patients whose Hermes might come back borderline, very mild elevations, which tells me that that they're either not reacting too strongly to the moisture damage or that the amount of moisture damage is very minimal. I think in those situations, installing air filters throughout the house can reduce the number or amount of mold toxins and other inflammagens in the air and actually make it safe for that individual. As far as models go, I think there's a number of really very good systems out there. The Air Oasis, I think, is probably one of the cheaper approaches that can work really well. It's, I think, especially good at removing VOCs compared to mycotoxins, although it will work in both areas. If you're looking at something a little bit more expensive, the IQ Air, I think, is also a very good investment. Many times I will recommend a combination of both if an individual has a reasonably large living space. I find in my experience the IQ Air is very good at removing mycotoxins and maybe not quite as good at VOCs, whereas the Air Oasis is a little bit different, so they tend to complement each other extremely well.
Perfect. That's very helpful. So can a person get well if they are living in an environment with mold, they are genetically mold or multi-susceptible, and they do not take any steps to address it?
If they're having an inflammatory response to mold, okay, because I think that this doesn't always have to be a mold susceptible individual. If you have a documented inflammatory response to their home, the chances of them being able to recover in an expedient fashion are practically non-existent. They may recover partly, but it's going to be an uphill battle. It will take a lot longer and it'll be a lot more expensive.
Yeah, very good. Thank you for that. So let's talk a little bit about MARCoNS, multiple antibiotic-resistant coagulase-negative staph, which colonizes, as I understand, the sinuses. How do you approach testing and treatment for MARCoNS, and how significant is that in the overall treatment journey for your patients?
So MARCoNS, there's a lot of misconception out there. MARCoNS is not an infection. It's actually just colonization of the nasal passages. And these bacteria can produce compounds that will then degrade circulating MSH, which then further ends up compromising the endocrine system. I tend to go after MARCoNS typically in a patient that has both mold and Lyme. I will try to do whatever I can to eliminate the mold exposure first, then go after the infections. Once the infections are gone, then we address the MARCoNS at that point. As far as addressing MARCoNS, it can be challenging because if someone is still having an inflammatory response to moldy environments, one of the key pieces I find helpful in increasing the success rate of the MARCoNS treatment is to help them eliminate or minimize mold exposure. BEG, which is a compounded nasal spray with bacitracin, EDTA, and gentamicin, works fairly well in most of our patients. If it does not work, there are other alternatives out there. My second choice is usually doing colloidal silver nasal spray, along with compounded EDTA. The EDTA is very good at breaking down the biofilm in the nasal passages. The colloidal silver has very good antifungal as well as antibacterial activity. With both of these treatments, whether you're using colloidal silver and EDTA or the BEG nasal spray, doing regular nasal irrigation, typically with a little bit of salt, saline solution with a little bit of Restore and a pinch of glutamine, can also help in increasing the success rate.
And by Restore, are we talking about the Zach Bush product?
That's
the
correct.
One that's also used. It's kind of funny that you say that. I just happen to have here the nasal spray of Restore.
Oh, okay, that's right. They recently came out with it.
Every now and again, I take a couple puffs. So let's talk about VIP a little bit. You mentioned that. You mentioned that you've had some good success in VIP, helping to really raise MSH in some of your patients. How often is VIP a significant benefit in someone's journey? Are there some people that don't tolerate it? And what are some of the things that you have to do to kind of prepare the patient for the use of VIP?
Let me tell you first thing, VIP always works.
Cool.
When it doesn't work, it usually means that you've missed something. I find that patients that have ongoing unidentified chronic infections, patients that are having ongoing mold exposure, patients that have ongoing viral reactivation, these are the individuals that typically will not be able to tolerate the VIP. And usually the feedback I get is that, Doc, I don't feel anything. And when I look at their MSH levels, they're not climbing. They're either staying the same or actually coming down. So usually what that means is that I've either missed something or they got mold exposure while they were on the VIP and may have gotten sensitized. One of the things I've recently started doing is if a patient may get periodic mold exposure from being exposed to public buildings, I will go ahead and put them on cholestyramine, typically about 3 times a day. And that seems to give a little added protection from having a big inflammatory response to an exposure, which may then compromise the effectiveness of the VIP.
Yeah, that's fantastic. So I think we've talked a lot about the mold side of your focus in your practice. Let's talk a little bit about Lyme and some of the other issues. So what are some of the tools that you find most helpful in supporting the body against Lyme and co-infections?
Scott, there's really no shortage of various antimicrobial tools that are out there, especially now recently. I mean, we have obviously the option of using antibiotics, either oral or IV. We have amazing blends of herbs, Beyond Balance. There's Byron White, Nutrimedics, Jernigan, Maple Herbals. There's a number of them out there. So in my practice, I'll typically mix and match, depending on what I feel is appropriate. And then if someone wants to go out of the box, there's biooxidative options available out there that people can even do on their own at home. Rife machines. The key, I think, is that when you've addressed the blocks and there's nothing else coming in the way, the Lyme treatment actually progresses very nicely and very easily. My personal preference as the years have gone by is to use herbs more and more. I find that they are very effective. They give me a lot of flexibility in how I dose them. My personal approach has been to use micro doses, very tiny amounts. And, some of these formulations are so strong and potent that, I'll start patients sometimes out as little as half a drop 1 to 2 times a week, and they're herxing. significantly. And by the time they get up to 2 or 3 drops once a day over a period of a few months, that respective bacteria is gone. It's really remarkable.
Yeah, that is definitely impressive. And I think so many people have the idea still that antibiotics are more potent and that herbs couldn't possibly do what antibiotics do. And yet you see some of the formulas and blends that are available to us now, like you're mentioning, where small amounts lead to these significant die-off reactions. I don't think we're at that place anymore where one can make the argument that the herbs are not potent.
Yeah, I think the key is that you want to use the herbs in a unique way. A lot of times, I think patients end up using herbs the same way that they would antibiotics at full recommended dose, which is typically 15 to 20 drops twice a day, and they don't see any response. And I think that you're using too much too fast, and there's this. It'll trigger a massive inflammatory response, and then within a day or two, it just stops working, and then patients don't feel anything.
Yeah, that's definitely an interesting concept. And so it sounds like if you do something that's too aggressive, the body almost tags that substance as more of a threat. And it doesn't then have the ability to utilize it to move your healing forward, but it sees it more as something that it really needs to not readily accept into the body. Is that kind of a reasonable, when you use the term sensitizing?
Absolutely. When I look at the studies, like, for example, with something like mycoplasma. Mycoplasma is a intracellular bacterial infection. It's chronic in a lot of patients, even those that don't have Lyme. And it's very difficult to eradicate. The typical protocols, patients are on multiple antibiotics for, 8 to 10 months in order to try to eradicate mycoplasma. And even then the success rate is, at most maybe 50 or 60%. We can take one of these herbal blends that are designed for mycoplasma and over a period of 3 months, using very micro doses, eradicate and have a blood test that becomes normal.
Wow.
And to me, it just speaks to the power of these blends.
Yeah, absolutely. So are there certain Lyme-related infections that you feel create the most symptoms for your patients, or that are the ones that take a little more focus to really address and resolve?
I think Bartonella takes the prize on that one.
I would agree.
It's a tough one. You get so much neurocognitive symptoms with Bartonella, with agitation and anxiety and seizures, and it's a heart infection, and I find that I have to come at it very slowly and do more aggressive detox support than I normally would when I'm addressing that piece, Bartonella. And it typically takes a while. It's not unusual to have to treat Bartonella for, easily 4 to 6 months, to make sure that it's gone.
Very good. So do you think that the goal of treatment with Lyme and co-infections is to fully eradicate every last Lyme and co-infection microbe, or is that really not a requirement for recovery? Do we get back to a point where the person may still have a few of these bugs around, but then their immune system is better able to kind of manage it over a longer period of time? What are your thoughts on that?
Well, my patients many times ask me, can we have a cure for Lyme? And I make it very clear that I don't think that it's possible to have a cure in the traditional sense that most people think of. We know from the scientific studies that these bacteria, especially Lyme, can persist in the organs and the tissues even after the blood test has become normal completely. If you are doing energetic testing, whether it's ART or with a computer, this type of testing can be much more sensitive than a blood test. So it's not unusual sometimes to get an individual who has responded to the treatment, who has become symptom-free, their blood test has normalized, but you may still have tiny areas of stress still showing up from these organisms on ART testing or with electrodermal screening. I think if we can get our patients at least up to that point where the blood test has normalized, the patient's symptoms are completely gone, and on ART or computer testing, the stressor that's showing up, if it's still there, is very minimal. I think if we can get an individual to that point, I think that they're safe. And then the next focus really becomes on supporting and repairing the damage that's been left behind so that their immune system can get strong again.
Yeah, I agree. And I don't necessarily find the concept that we maybe can't get rid of every last bug to be something that I find stressful anymore. I actually kind of find it empowering that the goal really is to become symptom free, and that's an achievable goal, but that there's probably many people running around with these same kinds of microbes that are completely healthy, never have a symptom. They're out playing soccer, football, baseball, whatever. And it may be because of a lot of the other types of blocks that you talked about, their ability to detoxify and whatnot. So I don't necessarily think that the presence of the bug necessarily means the person will still have symptoms. And we look at something like an exposure to chicken pox as a child, right? We don't have chicken pox for our entire lifetime. We don't have symptoms of it. And yet, if we're under a lot of stress as an adult, maybe then we develop something like shingles. So that's kind of more the way that I try to think of it. Let's talk a little bit about parasites. So you mentioned parasites earlier. How often do parasites seem to be an issue in patients, and how often do you need to treat them to move things forward?
I think parasites are far more common than most people realize. I'll typically look at an individual's history if they've done a lot of extensive foreign travel. It's definitely at the top of my list to look for. But even individuals that have lived in this country, it's not unusual to have one or two minor protozoan parasites, for example. The traditional testing for parasites, I think, is very limited. I think that when the stool sample has been sitting around for a while, a lot of the enzyme systems can degrade some of these parasites, and they're harder to visualize under a microscope. My personal preference is to use energetic testing as well as stool testing to make sure that I'm not missing something. Historically, I've found that even some of the more superior labs that do parasite testing, they seem to find protozoan parasites far more often than other flukes and nematodes and other types of parasites. So I think this is where energetic testing can really shine.
And is this an area where you also find the herbs generally helpful, or is this an area where sometimes the pharmaceutical antiparasitics move the person forward in a faster or better way?
Yeah, I think for protozoan parasites, my go-to formulations are almost always herbs, and I think that they work really well. Even for protozoan parasites like Blastocystis hominis, which typically tends to dig into the lining of the gut, 2.5 to 3 months of a gradual ramping up program with certain herbal formulations can be extremely effective at wiping out these organisms. On the other hand, for helminths, nematodes, I tend to lean more towards antiparasitic medications. Many times I will combine them with some herbal or homeopathic formulations. I think it's important with many of these organisms to do a cyclical approach because they tend to lay eggs, which are resistant to many of these compounds. So typically, I'll do anywhere from a 17 to 14-day cycle with a 10-day break in between. And typically 2 to 3 cycles is about the average that I need to do in order to wipe them out.
Okay, very good. Thanks for that. So we talked about the importance of detoxification, especially in certain HLA types. What are some of the tools that you like to use to support detoxification with your patients?
So let me emphasize here, because what we're doing is we're not promoting detox. We're actually opening up the exit doors. And I think that there's a big difference between the two. If you're trying to do active detox, where you're trying to pull toxins out of the tissues, whether it's heavy metals or chemicals or pesticides, you're only going to get more toxic, and it's going to actually jeopardize the treatment with Lyme. So what I'm trying to do here when my patients are on Lyme treatment is to open up the exit doors. For some people, the kidneys may be weak or the liver may be weak. So there's a number of homeopathic and herbal compounds to support these two organs. GI support is almost always a must, and there's a number of different binders out there. In addition to that, making sure that the patient is getting at least some kind of exercise every day. Now, I understand, many of these patients are extremely compromised and have severe fatigue, but even going for a 5-10 minute walk, 2 times a day can get the lymphatic system moving and help dramatically in keeping the toxicity down. In addition to that, Epsom salt baking soda baths can be very helpful, especially if you don't have an upregulated CBS system, which is the transsulfuration pathway. If that's upregulated, they're not going to be sulfur intolerant. But in other individuals, Epsom salt baths can be very helpful. I'm also a big fan of ionic foot baths. I really like, having my patients do that periodically, especially when they're in the middle of a severe Herx reaction. There are a number of tools, and my feeling that I explain to patients is that the more that they can do to support these detox pathways, the faster I can treat them and get them well.
Yeah, and your comment about, mobilizing toxins within the body. I know we've talked in the past about far infrared sauna, for example, and I think that that's sometimes a fantastic tool if those routes of elimination that you're talking about are open. But in people where they're not open and far infrared sauna potentially is mobilizing toxins, people think it's all getting sweated out, but it is mobilizing toxins within the body as well. And so in those people, it's possible that far infrared sauna is actually making them more toxic, is my understanding.
I have to agree with you completely, Scott. And I think that the time to do, aggressive far infrared sauna would be after the Lyme infection is gone and you've pretty much recovered and you're in the tail end of your healing process where you're trying to optimize your health.
Yeah, that makes a lot of sense. So how often do you find dental issues hold someone back? And is there maybe a story you can share about a patient where addressing a dental issue really moved them forward and was the primary block to progress?
Well, I'm glad you asked me that question, because I just presented a case at the Integrative Forum conference a week ago. This was a young gal, in very good shape, actually, a yoga instructor who had started getting progressively sick. Came down with the flu about maybe 8 to 10 years ago, if I remember right, and never quite recovered, had, a little bit, flu-like symptoms periodically. And then a few years before she came in to see me, she started to go downhill very rapidly. Long story short, she did end up testing positive for Lyme, and she also had issues with mold illness. She was living in a very moldy place when she had first come in to see me. So we went through our, typical routine where we identified the mold, helped the patient move into a non-moldy apartment, and then we started going after the Lyme. She also had a viral component that was quite significant. She was having recurrent, viral sores in the back of her mouth. When she came in, she was on prescription antiviral medications, which were still not adequate. So as it turns out, she did have a VDR mutation, a vitamin D receptor mutation. And one of the therapies that we instituted along the way, besides antivirals, was a narrowband ultraviolet B light box. But in spite of doing all of that, we found that she still wasn't responding to the Lyme treatment. she would get toxic, and whatever we used would just stop working, within a matter of days to weeks. After probably a good, 6 to 9 months of struggling to help her, I sent her to one of the practitioners that I use for energetic testing to see if there was something else that I may have missed. And as it turns out, she had multiple cavitations and root canals. So I sent her off to a surgeon, a dental surgeon, who had to do quite a bit of extensive work on her. And her recovery after that was much, much easier, much smoother. She responded to the antivirals in the light box. She responded to the herbs that we were using. As of this point right now, we're looking at basically starting on VIP soon.
Wow, that's fantastic. So let's talk a little bit then about, you mentioned VDR and vitamin D. So how important is the vitamin D level? How do these vitamin D receptor or VDR SNPs impact our ability to utilize vitamin D and thus our immune system's ability to respond to infection? And then what exactly does the narrow band ultraviolet light do for the body? I know you recently presented some different research on that, and that was quite interesting. So what are some of the things it potentially can do for us?
So, Scott, narrowband ultraviolet B light has been traditionally used in patients with psoriasis and eczema and a few other conditions. And there's a lot of very good scientific data to support this, where these lesions regress very quickly. We also have good scientific data to support that the use of narrowband ultraviolet B light box will raise levels of vitamin D. A lot of people think, well, if that's all it is, let me just take vitamin D. I don't have any psoriasis. That should be enough. And the reality is that the vitamin D receptor has a lot of other functions. And when you use narrowband ultraviolet B light box in individuals that have either a single or a double mutation in their VDR receptor, you'll find a number of different benefits. First and foremost, obviously, levels of vitamin D will rise, so they don't need to take supplementation. Number two, the research has shown that narrowband ultraviolet B will actually activate the vitamin D receptor. So that when you look at the vitamin D receptor, it has a whole host of different functions. And when you look at vitamin D, when you look at the use of the light box, not only does it support and stimulate the methylation cycle, which allows then individuals to unload toxins more easily, it also activates macrophages and various white blood cells so that your immune system is stronger and able to go after infections. You'll find that viral activity starts to come down fairly nicely. And all of this happens simultaneously. So it's not unusual as an individual is ramping up on the light box that they will go into detox. So we typically start our patients out very low, typically about 2 to 3 seconds over one part of their body, typically every 4 days or 2 times a week. And then we very slowly have them ramp up. And almost every patient will tell me that they will go into detox, even by going up by 1 second. Wow. So you got to have binders on board and adequate support with some of the detox organs. And typically by the time they get up to around 10 to 15 seconds, the viral activity has come down dramatically. They're feeling stronger. If they were homozygous on the VDR, one of the big symptoms we see is insomnia. And insomnia is one of the first symptoms to improve when they start the light box. So it's been a very exciting intervention.
Yeah, and it's interesting, just a little personal story here. So I've been myself using the narrow band ultraviolet light therapy now for about 4 or 5 months, and I had gone last week to Seattle and visited with my naturopath that's done ART work with me for a decade now, that I still check in with once in a while when I'm in town for conferences and things. And she said, it's interesting, you don't seem to be testing energetically for any viral stress, which I rarely see. It's almost always there in the background. And so I said, well, that's the effect of the light box. And so that was pretty exciting. So let's talk a little bit about ozone. I know that ozone is not something that you do as part of your practice, but that some of your patients have used it. Can you talk to us about what your patients have experienced when they incorporate ozone into their treatment, and what is it that the ozone is potentially helping them with?
So ozone, for those of people in the audience may not be familiar, is a free radical. It's 3 molecules of oxygen, bound, and it's an unstable molecule. So when it comes in contact in the body with any kind of an organism, it'll have very strong antibacterial, antifungal, antiviral activity. If you're thinking of doing this, you definitely want to make sure you run a blood test first for something called G6PD, glucose 6-phosphate dehydrogenase deficiency. A very small percentage of the population has this, and those individuals, it's better not to use ozone. Now, how do we use it? To me, I see the ozone more like a machine gun. You're going into the body and basically shooting everything. All kinds of different microbes. Whereas when we use antibiotics or herbs, it's more of a targeted approach. It's like a sniper. You're going after a specific organism. So if a patient expresses an interest in using something like ozone, they will typically start out really at a low dose, and we'll gradually ramp it up, and they'll usually be herxing along the way. And once they get to a reasonable maximum dose that I feel is safe, we will then get them tested again and see what's still left. And many times we'll add herbs at that point to pinpoint specific infections that might still be there at a low level.
So since ozone is more of the machine gun, is it generally the case that you want to use the snipers first to be more targeted and then use ozone towards the end? Or do you use it sometimes in patients early on and just support their ability to detoxify because it's going to address a broader number of things?
Yeah, sometimes, patients come in and they don't have a lot of financial, reserves. And I think that, when you're using individual herbs, it can, add up after a while. Plus, it's a longer, process. So many times if someone, has an ozone machine or they have access to it and their funds are limited, we will go with the ozone initially up front with aggressive detox support, go very slowly, and then we'll add the herbs at the end if required.
Yeah, that's great. So you've talked about some of the energetic interventions that you may use in addition to antimicrobial therapies. Can you tell us a little bit about biomagnetism, how you use that with patients, what it does for them, and then how does that fit into your broader treatment strategy?
This is, as you know, a tool I've been using now for a couple of years, and I'm really excited about it. I think it's a way of coming at these chronic infections from a whole different angle than what ozone or herbs or antibiotics might do. It seems that many of these organisms will create a block or some kind of a barrier that prevents the immune system from being able to recognize them. Now, we know that many of these organisms will produce a biofilm, but my suspicion is that there's something more beyond a biofilm that these organisms are able to erect that prevents your typical antimicrobial agents to be able to reach them. Sometimes it's not unusual where we will go after a particular organism and we'll be able to wipe out maybe 90% of it, But that last 10%, it's like a stubborn layer that just doesn't go away. And this is where I think biomagnetism really shines. I know in my case, I'll share a story. I was fighting mycoplasma, and I was using these couple of these herbal blends that are very powerful, and I had ramped up to maybe about 3 drops, and I just hit a wall. I could not go any higher. I would get so sick if I went past that, and my body just wasn't handling it. So this was around the same time that I came across biomagnetism, and I went to a biomag practitioner who was doing a little bit of muscle testing and found 5 different strains of mycoplasma in my body. I was shocked. And after my first treatment with her, which lasted for about maybe an hour and a half, 2 hours, I went into a herx that lasted for 3 straight weeks.
Wow.
I have never herxed so much just from that one treatment. And when I went back at the end of that time period, the mycoplasma was gone completely. And I had a couple of other practitioners check me also afterwards just to make sure, and sure enough, it did not show up and has not returned since then.
Wow, that's fantastic. Yeah, and for those listening, this biomagnetism is a system the doctor that created, I believe, is Dr. Gois. It's very helpful for people. I have talked to many people that have had similar Herxheimer type die-off reactions, sometimes right in the middle of the session. And essentially what's happening is, my understanding at least, and you can correct me if this is incorrect, my understanding is that there's various pockets in the body where the pH kind of shifts or is shifted by the organisms to kind of provide them with hiding places throughout the body. And by using magnets on different places on the body, it kind of disrupts these more areas where the microbes are sequestered, essentially, so that the body then can help to get rid of them.
Yeah, that is the theory. Unfortunately, we really don't have any science to know whether that's truly what's going on or if there's something else. So, all I have is just from a clinical perspective, my observations, as you've, described, is that people do tend to herx pretty consistently. It's not unusual to need maybe a series of these, maybe, 3 to 5. Typically, we try to space them apart a few weeks apart so that they have a chance to, recover. And I typically tend to use this modality towards the tail end, when most of the infectious load has already been addressed.
Yeah, that's fantastic. So how do stress and the mental, emotional aspects of health fit in? How significant is mental, emotional health for your patients? And then are there specific tools that you recommend for dealing with that aspect of their health and recovery?
This is an area I think that is so under-recognized, and it is so important. Not everyone is interested in addressing this, but for my patients, some of my patients that are, I usually will bring it up. My own personal philosophy, Scott, is that, things happen for a reason. Anything in this world, whether it's you're dealing with cancer or heart disease or Lyme or, anything else, and, part of what I try to do with my patients that are interested and open to it is to teach them certain simple tools of stress management where they can start looking at, okay, why am I going through this experience? I think that sometimes, not always, but in some cases, people need to make a change in their lifestyle, the way they approach life, the way they live life, to find a more healthy balance that can allow them and support them in their healing process.
Yeah, absolutely. I agree. It's such a critical area, and certainly one that I've had to focus on a lot myself. And, that work is really never done. I think we're always needing to focus on mental, emotional health and stress, and it's an area of constant focus. We've talked about many things during this discussion that are potential blocks to moving a patient forward. Let's just kind of talk, before we get to a few wrap-up questions, let's talk a little bit about dietary recommendations. Is changing the diet important? What type of diet do you generally find helpful for patients? And then are there certain times when you're maybe addressing a certain phase of treatment where those dietary requirements need to change to something else?
That's a really good question. I feel that the diet an individual needs is actually changes as they go through their Lyme journey. When patients first come in, they have so much gastrointestinal inflammation. We know that the Lyme bacteria invades the lining of the gut. We know that mold will also cause an inflammatory response in the gut. And then if you have viruses and dysbiosis, SIBO, all these influences, bottom line is that it results in carbohydrate intolerance. There are very specific enzymes that help in degrading carbohydrates that are found on the lining of the gut lining. And when that lining is inflamed, those enzymes are wiped out. So if you continue to eat a lot of carbohydrates, they don't get fully digested and absorbed, and then go down further into the colon and serve as food for the overgrowth of abnormal bacteria, resulting in SIBO. So when patients first start out with either Lyme or mold, I typically will have them on a paleo or a modified paleo type of a diet. Lots of clean, healthy meat and seafood, as much vegetables as they want, small amounts of nuts, seeds, and beans and lentils. We try to avoid all refined carbohydrates, completely avoid gluten, dairy, and minimize complex carbohydrates like rice and potatoes in a significant way. Now, as the individual starts progressing, their bodies need carbs. I mean, that's the bottom line. You cannot eliminate carb 100% and be healthy long term. Short term, it works. So as the level of inflammation starts coming down, and as the Lyme bugs go away, and we start working on repairing the damage left behind in the form of VIP to help repair the endocrine system, PK protocol to help repair mitochondrial function and get the gut lining starting to heal. We may even do a little bit of LDA to desensitize the allergic reactions to foods. As we go along this path, the gut lining starts healing up, and now is the time to start introducing carbs and slowly ramp up to a healthy level so that you have a good balance between carbs, proteins, and fats.
Fantastic. That's very, very helpful. For those people listening, the PK protocol that Dr. Patel referred to is from the work of Patricia Kane and uses phosphatidylcholine and other substances either orally or in an IV. And that is often something that can be helpful, especially around detoxification, repair, regeneration, cellular health, those types of things. And that's something that Dr. Patel has experience with his patients as well. What are the most important things that you do in support of your own health on a regular basis?
Well, that's a very good question. I think that, everyone, once they've lost their health and regained it, will value their health so much that they will want to do something on an ongoing basis. And fortunately, there's a lot of tools out there. Personally, I try to get some level of exercise on a regular basis, whether it's hiking or, something. But I also am a big fan of Qigong. Qigong is an ancient martial, not really a martial arts, but it's an ancient technique. And Tai Chi is an offshoot of it. It's about 5,000 years old. And it's a way to move the Qi through your body. There's a number of different schools out there that will teach different techniques. And it's really not that hard to learn. And if someone is drawn to that, I would highly encourage you to find a good teacher. Typically takes maybe 30 to 40 minutes, 2 or 3 times a week, can make a huge difference. It's like getting an acupuncture treatment essentially on your own. So Qigong is a big tool, physical exercise, eating healthy. And then for myself, I've been involved in a form of meditation, for the past, 30 years now. So to me, that's a way to it's a way to feed, the deeper parts, that we all have. Physically you could be well, but if your mood or you're cranky, you're irritable, you're being stressed out, this provides you the support that you need in those areas.
Fantastic. It is interesting because the work you do, I know, is certainly challenging and can be stressful, and yet you are one of the most balanced people that I've ever met, I think. So
I don't know about that.
I know that
Speak to my staff, they may give you a different story.
I know that it is an area of focus for you. So where can people find you? How difficult is it if they'd like to get an appointment with you to be their practitioner? How do they go about that?
We just recently moved our office. We're in Foster City. We used to be in Redwood City. Our address is 1098 Foster City Boulevard, Suite 305. You can get a lot of this information on my website, drrajpatel.net. As far as appointments goes, we're typically booked out for new patients 1 to 2 months on the average. It varies, up and down.
Fantastic. You have been a mentor of mine for several years now, and I have had conversations with many of your patients over the years, and it excites me to see the progress that they often make. I certainly appreciate all that you've done to help those of us that have either had Lyme or still dealing with Lyme and mold issues and all of those. We are certainly very blessed to have you as a resource, and I appreciate your time today and being on the show. So thank you very much, Dr. Patel.
Thank you for having me. Appreciate it.
To learn more about today's guest, visit drrajpatel.net. That's drrajpatel.net. drrajpatel.net. I appreciate your support of the Better Health Guy blogcasts series. If you'd like to follow me, you can find me on Facebook and Twitter as Better Health Guy. The show can be found on YouTube, iTunes, Google Play, and Stitcher. If you'd like to support the show, please visit betterhealthguy.com/donate. And if you'd like to be added to my newsletter, please visit betterhealthguy.com/newsletters. I'm looking forward to many more shows ahead and appreciate your interest.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.